But are Republicans going against their promise of transparency and proper procedure by scheduling this vote without hearings? And more importantly, what will repeal do to our already devastated health care system? Here to offer his take on the issue is Seton Motley, president of lessgovernment.org. Welcome back, Seton.
Good to see you, Tom. Happy New Year.
Thank you. Happy New Year to you, too. Seton, on the plasma behind us, we're going to show a little clip.
Okay, visual aids. I like it.
Yeah, if it shows up, of something that happened some years back in September. Do you have that, Kevin?
Some years back in September?
Maybe not. Yeah, here it is.
Oh, that's September.
Yeah, that's September.
Okay.
Okay, that many people die every 3.5 weeks in the United States because they don't have health insurance.
That's a lie. That's a fraudulent number.
45,000 people.
That's a fraudulent number.
What do you think it is, 30,000?
No.
9/11, what, once a month?
No.
9/11 every 2 months?
And it's not the government's responsibility to provide health insurance.
9/11 every 4 months?
The Constitution mentions a lawyer. It does not mention a doctor.
The
There's a reason for that.
Constitution mentions general welfare twice.
Yes, and in neither case do they define it as medicine.
In neither case do they define it in any other way
That's
either.
exactly right.
They don't
means
define it as...
Then you go to the 10th Amendment, you go to the 10th Amendment and say if it ain't there, it ain't supposed to be there.
No, you haven't read Article 1 of the Constitution. It says Congress gets to decide what this means. It's very simple. Congress gets to make the laws.
Yeah, no, they get to make the laws within the bounds of the Constitution.
So, you know, 45,000 or whatever the number is, 20,000, whatever, people die from our not having health insurance.
That's a fraudulent number, and Article 1 does not say what you just said it means, but okay, go ahead.
So by wanting to repeal Obamacare, aren't these Republicans doing more damage than Osama bin Laden did to this country?
The reason healthcare is screwed up to the degree that it is now is because there's so much government intervention and involvement already.
Okay, so let's go through some of that government intervention. You can tell me which of these things you want to get rid of.
Absolutely.
These are parts of Obamacare that they're already in place. No child can be denied insurance coverage because of a pre-existing condition.
Terrible idea.
Terrible idea. So
no one will buy health insurance. It's an assault on the insurance industry to get rid of private insurance. If you don't have to buy coverage until you're sick, no one's going to buy coverage until they're sick.
I'm not talking about being sick. I'm talking about pre-existing conditions.
That's what I'm saying.
The sick comes later. That's number 2. But this is a child who, let's say that they had acne when they were 12, and now they're 16 and they want to buy health insurance. The insurance company can say, no, sorry, you have a pre-existing condition.
Well, denied, because I have the same problem. I have scoliosis. I get denied insurance claims all the time based on my scoliosis.
Isn't that absurd?
No.
Should
No.
Okay, all right.
Absolutely not.
Okay, to hell with the kids. I got it. Coverage can no longer be canceled when the policyholder gets sick. Already covered, you get sick, the insurance company says, we're going to do something called rescission. They've done it to tens of thousands of people.
They haven't done it to that many. They've done it to some people, and they were usually conditions that they went beyond. They violated their insurance policies.
Yeah, in most cases, it was the insurance company discovered that they had acne when they were 16. Well, and now they're dying of cancer 30 years later. But you forgot to write it down on the form.
That's not what happened, Tom. You know, Tom, I'd like to bring you back over to reality. It's way over here. That's not how it goes.
Testimony we saw before Congress. Okay, so you think that insurance companies should be able to cancel you when you get sick. Insurance companies can no longer impose annual or lifetime limits on payments for care.
That's fine. I think they should be able to do that if they have to. You buy a policy.
They should be able if
you want to buy unlimited coverage, you pay for unlimited coverage. If you want to buy a $2 million policy, you pay for a $2 million policy.
And okay, that's actually not unreasonable. Adult children can remain on their parents' policy.
That's absurd. That is patently absurd.
Why?
Because adult children aren't children. Adult children is like hot, cold, or wet, dry.
21? 16?
18's good. 18's good.
All right, 18. And
it's like saying wet, dry. Adult children.
I would suggest to you that there are a lot of young people who are 26 and under who are still going to college. They don't have a means.
Get a job. Get a frickin' job.
In other words, forget about going to college. Forget about your goal of becoming a doctor. Forget about your goal of becoming
education and knowledge are off.
Seton Motley, a well-educated guy.
I barely went to college. Education and knowledge are often mutually exclusive.
Maybe you're making my point. I don't know. Policyholders cannot be charged extra for seeking urgent care in an emergency room that's not in the insurance company's approved network of providers. Well, so you're hit by a car. You're taken to a hospital. The ER doc says, oh, you got the wrong insurance company.
I want to go back. Okay, on that one, I want to go back to the original point I made. The reason health insurance companies only make 2 to 3% margin profit which this bill will totally erase.
Now that profit is calculated after Stephen J. Hemsley takes his $477 million in income for his first 5 years of work at United Healthcare.
Then don't bother. Then if your shareholders have a problem with it, it's not the government's business. It's not your business. The only two people.
It is my business if it's a monopoly.
No, it's not. Well, it's
or
not
a duopoly.
And you know who creates a monopoly? Why wouldn't Barack Obama allow you to purchase insurance across state lines in his Obamacare?
Because insurance is regulated at the state
I find
level.
it the height of hypocrisy that he claims a mandate is okay.
What you're trying to do, what you're trying to do, no, I know
Interstate
where
Commerce
you're going
Clause.
with this is the same thing as the credit card companies did, which is they will all then go to one state like South Dakota did for the credit card companies, where they've got the crappiest laws and the crappiest enforcement.
It's called free market.
That becomes then the national standard.
It's the height of hypocrisy.
You are saying that you don't like the 10th Amendment. You don't want states to have the right to be able to regulate.
It's the height of hypocrisy to say we can mandate health insurance based upon the Interstate Commerce Clause, but you won't allow us to buy insurance across state lines.
Okay, and the last thing that just went into effect, you don't like the fact that insurance companies have to spend at least 80 cents out of every dollar that they collect.
I don't want the government
providing care.
I don't want the government mandating how businesses conduct their business.
But Medicare can do this for 3 cents out of every dollar.
Medicare is hundreds of billions of dollars in debt. They pay 20 cents on the dollar.
Just fine.
No, they're not. It's hundreds of billions of dollars. Don't be fraudulent. It's hundreds of billions of dollars in debt. They pay doctors 20 cents on the dollar, which the cost of which then gets shifted onto private sector people like us. And that's what's destroying the insurance. That's what's destroying the private healthcare industry.
We will leave it at that. Seton Motley.
Good to see you, man. Happy New Year.
Yeah, thank you. Happy New Year.